All right, cool. All right, so welcome, guys. Let me just kind of take it from the top real quick. I'm going to do a little speed round on that. So for health insurance, overall, we have ACA and we have non-ACA. ACA is going to allow you to be able to do or to have coverage that's based upon your income and household size, covers pregnancy, pre-existing health conditions, okay? And non-ACA, which is true major medical, by the way. ACA is true major medical. Non-ACA over here on the other side is going to be short-term medical, which is the closest thing to major medical, which lasts for 12 months or shorter, 6 months, 3 months, whatever the person needs, or as long as 2 years, some even 3 years, without having to reapply. Applying, you have to be healthy for non-ACA. So for non-ACA, being healthy means you're answering no to a series of medical questions. Yeah, I'm going to run through them again. So last 5 years, have you ever been diagnosed, treated, or taken medication for, or had signs or symptoms of cancer, tumor, stroke, heart attacks, chest pain, or heart surgery, COPD, emphysema, Crohn's disease, liver disorder, degenerative disc disease in the neck or back, rheumatoid arthritis, kidney disorder, diabetes, alcohol, drug abuse, chemical dependencies, or any type of neurological disorders, as well as AIDS or HIV. You do have to be here legally as a US citizen or resident. Not all carriers on the private market, which is non-ACA, they do not require a social security number. So as long as they're here legally, that's the most important part. Obviously not pregnant, processed adoption, undergoing infertility treatment. That's when you would want to go with plans like the ACA. That's the true major medical. So there is another option on the non-ACA for health insurance. It's called the indemnity coverage. A lot of plans like AFLAC, where they pay you. The list of questions is going to be located during the application. So while you're submitting the application with the client on the line after quoting and having them accept the policy, you're going to go through the list. You're going to see everything there. Now, these companies, these private market non-ACA companies, they're going to do a soft script check is what that's called. So they're going to see if they've been prescribed any medications in the last 5 years. And if any red flags come up, they will get denied. It is very easy to put people that are not married under there. So that's pretty helpful as well. Let's say if they're common law, they've been together for 5, 7+ years, then yeah, I see it as okay to be able to put them on there. I've never had a problem with having a boyfriend and girlfriend, but you also got to use your own, discretion. Like you don't want to put somebody on there that's, you don't want to put anybody on your health insurance that is that they've only been together for a few months, let's say, or they just moved in together and they've been together for a year. Use your discretion. I would say I think anything more than 2 years is a good solid relationship, so where you can count on them not breaking up and having to cancel that policy there, get that charge back. Now, the way that commissions work, I'll cover that real quick, is the ACA is done monthly. So that's very much of a residual income on there. When you come to private market and non-ACA, that's when you're going to be given, you have the option. You could do as earned, which is monthly, or you could do a 6-month advance. So you get 6 months of the commission advance. And then on the 7th, 8th, 9th, 10th, and 11th, and 12th month, the rest of the year, you're going to be receiving that as earned. Or again, you could do it as earned as well. Now today, I might be able to cover a little bit of both, but mostly today, what I wanted to offer, or what I wanted to have you guys take a look at, is the non-ACA. That's going to be the private market insurance. And our number one carrier that we have right now is going to be National General. Mainly because they have a rider, we want to call it. It's called a Triomed, that is guaranteed issue. This is going to go very well with clients that do have pre-existing conditions that aren't able to get approved for private market insurance, let's say. So and I'll go into details about what those plans cover. Welcome, guys. I'm not as handsome as the Tony Martinez. I got some hair. but I'm going to be covering some health insurance today. So welcome to the call. Welcome to the call. If you don't know me, my name is Robert Rawl. I'm pretty much the department head of health insurance. So at any point, if you ever have any questions, any concerns, please don't ever hesitate to reach out to me. If you don't have my number, just reach out to me on Boxer and we'll get connected. So I know that Tony also has a referral program for us. If you guys go onto your website, the TKO website, one of the very last things says TKO Health. That's where you have the option to either get appointed with some of the carriers that we're working with, or you just use it as a referral system. The referral system, once we have anything that's closed or it's a good referral, I believe Tony's also going to be offering life leads per health insurance referral. So if you don't want to get involved with all this extra stuff, trust me, I understand. I really want to get into taxes, but there's not so much time into that. So after open enrollment, I do plan on getting into it. And then the rest of the network that we have, e-commerce has got my mind blown. I'm telling everybody about this e-commerce, that I know of that has a little bit of money there. So, and once I get it, trust me, I'm jumping on that e-commerce thing as well. But as far as health insurance goes, it's exactly what we're going to be talking about today and how you could use it to leverage for other products. Because guess what? If somebody's going to tell you that they have a $150 to $200 budget and I got their health insurance at $90, there's a bit of space to fill. So guess what we're going to do? We're going to fill in that rider I was telling you guys about, plus life insurance. And any life insurance that you have as a referral agent, guess what? If you're licensed and contracted, you will get split. So you're just going to refer and receive money. So you can leave it up to me and anyone else that we have on the team that's going to be certified in their health insurance and get things going for you. So you can count on us to be able to handle that. So does anybody have any questions so far on the health insurance before I go ahead and jump into some of the quoting? Going once.
I do. It's Tanisha.
Hey.
So you said we use Health Sherpa to find the quotes for people who are needing ACA. And
Yes.
then what are we using? What company is it? National? Is there
So
just one
National
company that
General.
we're using for non-ACA? Is that like a quote site or is that one company? And where does Peak fit into all of this?
Good questions. Okay. So ACA is going to be through Health Sherpa. Non-ACA is going to be different carriers. So right now, National General is going to be our number one. And then we're going to have United Health One, which also has non-ACA products as well as ACA products. So United Healthcare, kind of like Mutual of Omaha, how they have United of Omaha, Mutual of Omaha, they have different names within Mutual of Omaha. United Healthcare has the same thing. They have their AARP, which is for their Medicare. Then they have United Health One, which is for private market non-ACA products. And then they just have regular United Healthcare, which is for ACA products. And the way that Peak falls into all this is that they're the ones that's contracting us for ACA. So most health, we're in negotiations with the United Health contract right now for private, but National General we have solidified. So that A is a bit more cheaper or more cost effective. I hate using the word cheaper. More cost effective, and we have that Triomed that's also available in there that allows us to be able to get you the guaranteed issue riders for anybody that needs ACA. So you could use ACA for the health and then still quote National General for that rider to go along with the health. I hope that answers your question.
Yes.
Okay, awesome. Make sure you get contracted with Emeritus for dental and vision as well. Yes. So you do have to request the Emeritus dental and vision from Tony or from licensing. So we will be getting that done as soon as possible. All right, got a few more people coming in. All right, so Welcome, guys. Welcome, guys. Going to be doing some training today on the health insurance space. I will touch on the ACA if I need to on some of the quoting, but today's going to be mostly about the private market, which is the non-ACA. We're going to be doing the short-term medical through National General, and then also the rider, which is a guaranteed issued rider that can also go along with any ACA major medical that we end up getting our clients. So let me give you guys a quick example. I have a client that I had serviced this last year that I had a client that I serviced last year that recently had introduced me to someone. So I helped him out. So example, this gentleman lives in the Bahamas, but he goes and has a house in Florida. He is 64 years old. I'm able to get him a short-term medical insurance, but this year when he turns 65, he can no longer get on a short-term medical insurance. So I had to do crazy research all this week because his friend is over 65. So I have to do this for him as well. But because they're not US citizens and they don't have a social security number, they cannot get another short-term medical because they're over 65. So anybody that is over 65, do you know what kind of coverage they normally get if they have the social? Anybody
Medicare?
answer that?
Medicare?
Yeah, that's exactly right. Now you need to be living and working here in the US, paying taxes for, I believe, 10 years, if I'm speaking correctly here. And if you haven't and you don't have a social, guess what? If you're over 65, you can't get any health insurance. So if you have a residing country, which is going to be Bahamas in this case, you have to get international health insurance. So we have Aetna International, and then we also have Cigna Global. Okay. Now, these are not low premium costs, especially for people over 65. So the reason why I'm telling you this is that if you have anybody that's under 65 that does not have a social, but is here legally, you can get them onto this National General plan. Obviously, they have to be healthy as well, right? So they have to answer no to the series of medical questions, and then they have to be under 65. If you do come across somebody that's in that situation, which I've been doing this almost 10 years and I'm just now running into it now, then let me know, or you have to actually reach out to one of the carrier or they have regional sales managers that will run the quote for you. So you can't run the quote yourself, even though you're appointed with the carrier, you have to have somebody do it for you because they only have certain reps, I think like 4 of them in the country. Like that's how much business they do. You know, they have 4 reps for the country, maybe a little bit more, but that's the way that I understood it. So let me just, getting back to this, show you guys what it would look like. There. Nope. Let's do this. So for National General, we also call it Nat Gen. Pretty simple. Everybody's done quoting before. Let me use this. Let me just do myself real quick.
Rob, we see your email.
Oh, wrong window. There you go. All right, good. Glad I didn't have anything too personal up on there. Thank you for that. So this is the window that we're going to be looking at. So what happens when you have 4 screens in front of you and a phone and an iPad. So the quoting, let me just go ahead and go to the top. All right, just so you guys see what it looks like. And if you guys haven't subscribed to Morning Brew, then I highly suggest it. It's you know what, I'm gonna post it into the chat real quick, just in case, because that keeps you up to date on everything. I don't know if you guys have heard about this whole meta world thing. I'm just gonna touch on it real quick. Where was it? There we go. New name. Facebook's new connectivity, Mark Zuckerberg called the corporation will switch its name to Meta. Why? Because calling the company Facebook is like calling Rihanna a musician. It doesn't work anymore. Oh, wow, that's harsh. Excuse me, but Meta short for metaverse. If you guys have ever seen the movie Ready Player One, it's one of my favorites personally. And second, metaverse is where they live. Everything's virtual. So anyways, that's a whole nother conversation for another day. Go ahead. All right, cool. So ready to rock and roll here on the quoting. This is the National Journal, very beginning here. So you just start with whatever zip code. Child only, you can't have a child only, but guess what? They need to be at least 2 years old. So a lot of times the reason why I ever use this is because somebody, a parent, has to be responsible for the child's health insurance. So they're scrambling to get health insurance as soon as possible. Normally we'll just get them on a plan like this just to kind of hold them over till they can get coverage to somewhere else. Because if you are getting ACA coverage, household size and income is dependent on who you file on your taxes. It's just not who's in the house. You know, like you got grandma living with you, but she's got her own social security. She's got her own income. She's got everything else. Household size is taxes, all based upon taxes. So if there's a couple that has been split up or divorced, and some couples or some divorcees will switch every other year the children. So depending on who's filing the taxes that year on that child, it's always, so what we're doing right now is projected for 2022. So when I ask somebody, what is going to be your projected annual income for 2022? Now, some people is very consistent and they know exactly what it's going to be. Some people, you're going to have a bunch of different answers. They're going to tell you, I have no idea. Okay, well, are you starting a business? Are you getting a new job? You know, there's a lot of different reasons as to why somebody's income would fluctuate. No matter what, you want to be as accurate as possible without fibbing too much, let's say. So quick example, I know I'm kind of getting off the subject here, but the child only is pretty important. So again, 2 years or older, and you could get them on a short-term medical. Anything under that, most likely you're gonna have to try to apply for like some type of Medicaid or CHIP. It's pretty easy to do. And that'll help you during Health Sherpa too. Like if somebody's income is below, they're gonna tell you that this person is approved or can most likely get Medicaid or CHIP, which is usually the children. And then the adults will normally be able to stay on the ACA plans. But as far as, excuse me. As far as the health insurance goes, it's always on who you're filing your taxes with. To touch back on the income, let's say that you have somebody that's starting a business, which is most of us, right? You don't have steady income. You want to make 100,000 this next year. You want to make 200,000 this next year, but are you going to make it? Do you have the money now to pay for health insurance if you were making 200,000? No. So what I normally do for people in those type of situations is I'll say, okay, well, what did you make the last few weeks? All right. If you're going to be making more, that's great. But let's go ahead based off of what you're making right now, multiply that by 52 weeks or however you'd like to do that. and get them on the low end first. Say that they're making 30,000, 40,000 to start off. But it is so important, and you have to tell these people that, listen, once you start making more money, you have to report that change in income. Because guess what? When you go to file your taxes, you get something what's called a 1095 B or A form that goes with your taxes. Because all that money that the government's subsidizing, that tax credit that they're giving you, they're going to expect that back if you're not accurate on your income. So again, if somebody's plans on making a lot more that they're not making yet, it's okay to put it down low first, but it's very important to change it in the future. You just simply call healthcare.gov. You say, hey, listen, I got a new job or income change, and they'll adjust everything for you. You might end up paying a little bit more, but trust me, you want that rather than exactly. Yeah, I like the way you think, George. Great way to go ahead and cross sell for taxes. I already took the medicine, thank you. The vitamins. And yeah, otherwise you'll get affected really bad on your taxes, and trust me, nobody wants that. When they're expecting a certain return, or they're expecting to only pay a certain amount, and then they get hit with something hard, that's like a hard left hook. So finally my coffee. Okay, so let's go ahead and jump back into the quoting. So let's just do an adult for right now. I'm going to do me. Let me make myself a little younger. Cigars every once in a while, but no tobacco. I'm going to put yes on there, and I'll show you why in just a minute. Coverage date can start the very next day. Doesn't matter if it's the 31st. Look, midnight tonight, I can guarantee your coverage. You're going to get, as long as they can answer no to those series of medical questions, they're going to have a certificate of insurance within the next 24 hours. Okay. A lot of people, sometimes you'll get people on there that need insurance right away. First thing you want to do is ask why. Did something happen? What's going on? You got to let these people tell you what's happening, because if they are trying to use it for something that they're sick or ill or have already been treated for, but they need to get it for a surgery that they think is going to be covered, no, that is not what the non-ACA policies do. That is not what they do at all. They are simply more of a catastrophic plan. God forbid something were to happen, you can go see an urgent care for $50. Other than that, just about everything on these policies through National General is going to go towards their deductible. Okay, so again, everything that they're going to be paying is going to go towards the deductible, unless they have a copay. And most non-ACA plans have an urgent care copay for $50 or $75, depending on the carrier. But you got to sell it that way though too. You can't say, oh yeah, you have preventative and wellness covered, and don't get me wrong, it's technically covered, but is it a copay? Do I have to pay for it? Yes, it's going to go towards your deductible. Sell it for what it is. I don't ever try to make something, a piece of brass look as shiny as a piece of gold. No, that's not what we're here to do. We're here to give them the right products and let them know what it is and what it's worth. Because if you look at these same plans, let's just say that I'm making over, what is it, an individual plan? Hold up. Let me pull up my friend Paula's, where is it? I had it here. No, I think I put it under TKO. Yes, Seguro de Salud. So if you look at this here, this chart, right? So if I'm an individual and I'm making over 51,000, call it 52,000 a year, if you could see it. All right, so if I'm making over 52,000 a year, let's call it, I'm not going to get any tax credit. I'm not going to get any subsidies from the government. So an average policy is going to range anywhere from $300 to $500 a month. I'm healthy. I don't ever use insurance, but I want to make sure my assets are protected. You got over 60% of people that claim bankruptcy because of health costs. That's crazy. It's absolutely crazy. So if I'm over here and I get quoted Obamacare, I'm getting quoted $400 a month. I'm like, man, I never use this. I'm healthy. There's like, what's the point? Why would I pay all that money? So that's why we go over to non-ACA, the private market. What do I have here? Let's just see all plans. We're going to offer a few things. Now you can actually quote ACA off of here, but I wouldn't, because it's not as accurate. It's close, but not accurate. That's why we use Health Sherpa, because Health Sherpa is actually going to allow you to, submit the application. And it's a great back office. Keep all your clients' information, email. You could just jump back right into the plan where you left off. You could save. Like it's awesome for ACA, which is why we're using it. Now, so let's look at this. This is like the best plan that they have right now. Look at this, $289, $400. Okay, but guess what? If I decided to go with a plan through the ACA, that's a $2,500 deductible. That's a $600 plan. That's a $600 plan. But here it's only $400. Why? Pregnancy, pre-existing health conditions. Those are the main two biggest difference between ACA and non-ACA. Pregnancy and pre-existing health conditions. This does not cover pregnancy or pre-existing health conditions, only major medical through ACA. Non-ACA is going to be your short term. Now you have an option of different networks. Aetna is a good network, but they're more cost effective than Cigna, because Cigna is a much larger network. So that just went up to $437, almost an extra $40. But if you want to, let's say you have a high profile person that wants the best of the best, but doesn't want to pay $800 a month for him and his wife, no problem. We'll get you a Cigna network, PPO. You can go anywhere that you want in the country. PPO, what all that really means is that if you use in the network, you're going to get better discounts, let's say, or negotiated rates. I call all my clients, I said, that's a fancy word for a discount. Okay. If you go out of the network, then you're just going to pay a little bit more. That's all. I try to make it as simple as possible for the clients to understand what a PPO is. You go in the network, great. You go out of the network, you might pay a little bit more, but no matter what, you're always going to have coverage. Whereas HMOs you use within network, you kind of have to. If you don't, your deductible doubles, your copay doubles, almost everything doubles. So you're paying a lot more. Same kind of structure, but it's very definitive on how much more. It's usually double of everything that you're already paying. So if you got a $50 copay for the doctors, you can expect to pay $100. So let's see. All right. So this is my sweet spot though. Okay. My sweet spot's going to be in the 10K deductible. 5 to 10K deductible. Why? If you're healthy, you don't anticipate to use the insurance for anything, pay less monthly. What's the point? If something does happen, then that's why we add the rider. You don't have to pay that entire deductible before the insurance kicks in, because you're going to have something that's going to pay the first 5 to 10,000, depending on what plan we choose. So before I go ahead and jump into the TrioMed and show you guys what that's about, National General is the only company for non-ACA that offers 20% premium savings for eligible adults. Now, this is the questions, okay? If you know that they smoke, that's an automatic knockout, okay? They cannot get approved. They do have to have prior coverage. So yeah, no tobacco. Any insurance, even if it's short-term medical insurance, as long as they've had insurance in the last 12 months, I'll get to that in just a second for the rider. That's the TrioMed. And then the next question, lease or own a motorcycle. I know it's kind of a funny question, but that's their questions, right? Like, I think I would want to know that before I insure. That pool risk is going down if they're not driving a motorcycle. And then any citations with a DUI or more than one moving violation, including speeding tickets within the last 2 years. Excuse me. And then the next one, so if you've been diagnosed or treated or prescribed medication for high blood pressure, high cholesterol, anxiety, or depression. So 4 of them. If you've been diagnosed, treated, or taken medication for any one of those in the last 5 years, which is probably the biggest knockout, then they can still get approved, but they won't be able to get that extra savings, okay? And then the last one's going to be weight. If you're a male, got to be less than 240 pounds. If you're a female, you got to be less than 190 pounds. So not too hard. That they're not like crazy questions, but they're reasonable questions as to why they would want to get somebody on a preferred rate. So here, let's take a look at this real quick. So 364, let's just bring this down. So Aetna, $289, $2,500 deductible. Let's update this to yes, no tobacco, prior coverage, yes, preferred premium, yes, by answering no to all these. Update, $235. So I think that's what, a little over $10 in savings or so. So, but that's pretty significant. You're saving them. You could put that towards the next thing. So $10K deductible, look, $103. I went from paying $400, $500 for a really high deductible like this one, and now I'm cutting that into a fraction. But that's not it. Tanisha, we're gonna get to that rider. So we just come up to the top here. They do have dental plans. They're not bad, but Emeritus is way better, which is why we use them. And that's mainly for the client. That's not for us. Just because this is a higher commission doesn't mean that I would suggest that. If you're going to be, in this game for the long run and you plan on doing this for a while, mission before commission, right? You want to make sure that your clients are taken care of before your own pockets are taken care of. Zig Ziglar once said, you help enough people get what they want, you'll eventually get what you want. Good morning, Felicia. Thank you for joining us. We're just covering some health insurance right now. I know I'm not Tony. I do have hair. But as far as what we're going to be learning today is just basically health insurance. You have your non-ACA and your ACA. Right now, we're going over non-ACA, which you do have to be healthy for, and you have to get approved. So it is underwritten. The main reason, again, why we would want to use non-ACA is for healthy people making more than this chart right here. And if you want access to this chart, awesome. So we'll connect after this. So we will connect after this. All right. Let's see. Yes. So right now I'm covering non-ACA. If we have time, I will cover the ACA portion. All right. But right now, again, the non-ACA is going to be designed for people that are outside of this bracket. Individual making more than 52. A couple making more than 79. Just round up a little bit. That's what I would suggest. So even if you have, a couple and 5 kids, you better be making over 6 figures if you got 5 kids, man. But 160, that's a big number. You got to be making over $160,000 to not, or 160 or 59, to not get any tax credit or subsidies from the government. Those tax credit or subsidies help a lot of people out. So that's another reason why we're able to bring the cost down, but also give them plenty of value for things that they didn't think that they could afford in the first place. So that's honestly why I love this industry, just because health insurance is probably one of the most confusing types of insurance that's out there. Car insurance is okay. I mean, it's pretty basic. Life insurance, I mean, I'm sure we all understand, but the general population, they think life insurance, they think death, right? They think health insurance, they think horrible health. The way that this I want to say industry, but this nation, the US, our health insurance thing is screwed up. So it's on us to be able to clarify things, to be able to make sure that everybody's feeling comfortable with the decision that they're making when they choose their health insurance. And the great thing about it is that you are able to speak to them every year, just about every year. So if you don't do a annual review for your clients as is, this is a great way to almost force that annual review. Force yourself to be able to speak to your clients. Hey, how are the kids? How's everything going? Oh, okay, good. Have you changed income change at all? Did you get any more money? You know, or are you making more money, I should say? Did you open up a side business yet? Or whatever the case may be. And taxes is another reason. Taxes is a great reason to be able to follow up with people every year. So between health insurance and taxes that go pretty close hand in hand, you add life insurance to it, man. Plus the e-commerce, I'm excited. That stuff gets me excited, man, because you could help one person full circle. And it's like, I think the only thing we're missing is P&C, property and casualty. That is going to be the next level. But, you know, we'll say that for another day, another time. Right now, let's just kind of stay focused on the health insurance. So, so again, if they're within this bracket, you want to give them ACA. Yes. Medicare is a whole nother beast as well. It is Medicare is the most highly regulated industry in America right now, because, and especially in Florida, because Florida takes care of their seniors like no other. If you do something wrong to our seniors in Florida, you get the worst, probably death penalty if you did something that bad. No, but seriously, as far as Medicare goes, that's going to be Howard. Howard is the best at it. I know a little bit, but I'm not even able to sell it. So Howard is your go-to guy. You have any questions about that? He's the guy. So let's kind of, if you're outside of this, you're making more than this, and this is your household size, okay? This is the people that I want to talk to. All right. And they got to be healthy. Remember, got to answer no to the medical questions. So after I quote that $100 health plan, because he's healthy and doesn't drive a motorcycle and is under 240 pounds, these are the trial meds. Look, and it's guaranteed issue. You don't know what guaranteed issue means? It's the word itself means that doesn't matter what's going on with the individual. Doesn't matter. Doesn't matter if they have cancer. It doesn't have to matter if they have a tumor, stroke, any of that. They are allowed to be able to get this coverage, and it's not that expensive. So 2,500 CI critical illness, 2,500 accidental medical expense. Then it also acts as an accidental death benefit. So I'm putting on at least 5K, unless I'm trying to squeeze something in there. So 5K, let's take a look at this real quick. This is the easy one. All right. I don't really mention too much about the deductible because that's very minuscule compared to how much they're going to be receiving. So this is going to be accidental medical expenses, AMEs. What I tell my clients is think of an accident. Just about everything, right? As to the reason why you would need to go to the hospital or anything that would happen. You can accidentally cut yourself. You could accidentally slip and fall. You could accidentally do a lot of things. So the hospital is not going to investigate, exactly what happens as long as you're making it seem as an accident, right? Critical illnesses. So you're going to get up to 100% on the first diagnosis, and then after that, they're going to get up to 50%. Oh, excuse me. So amount payable for primary maximum benefit is 50% for a spouse and 25% for a child. So let's say that you have everybody under a health plan and you have more people on here and you add that, that's the way that it's going to work. But as far as the coverage goes, it's a great way to be able to give a guaranteed issued rider to this. So that's accidental medical expense and critical illnesses. Now, if you wanted to get somebody even better coverage, I would go to Mutual of Omaha. Mutual of Omaha has phenomenal disability, critical illness coverages, but you also do need to have your health license for that as well. You cannot only have your life license. So if you need help with that, just reach out to me or to Tony or any one of the team members that is available for to be able to quote that for you, just in case you're not licensed with that. Okay, so that's pretty much it. I wanted to kind of separate the two between ACA and non-ACA. You do have, the last thing I will say about this is you have the option to do 2 12 months back to back without reapplying. Reapplying just simply means answering no to those same medical questions I went over a few times: cancer, tumor, stroke, heart attack, so on and so forth. It does get a little bit more expensive, but guess what? You're guaranteed. So even if you do get diagnosed with one of those, any of those, then you're guaranteed to have the next year of coverage still, no matter what. So that's huge. Plus your commissions are also level, which means you receive the same amount of commissions the entire time. But does anybody have any questions for me at all for anything that we've covered so far, or health insurance in general?
Hey, Rob, it's Tanisha. So the trial med, is that's just to cover, does it cover like all the things that the other private doesn't cover? Or is it just critical illness?
She's getting a shower
I'm not clear
right now,
on
okay?
Oh, she is.
Yep. So accidental death, dismemberment, so loss of eyesight, speech, hearing, coma, paralysis, a lot of those things. And then you also have the accidental medical expense. I'll leave this up here for a little bit. But yeah, this is just a rider that's going to pay you a lump sum. So let's say if your deductible is $10,000, but you end up in the emergency room and you only needed $3,000 surgery. Guess what? You're covered. You don't have to pay for anything. Between the supplement and your health insurance, you might have I don't know. It doesn't matter. Let's say the total bill is $3,000, but you have a $5,000 benefit. It's covered. You wouldn't have to pay for anything. I hope that answers your question.
Okay, forgive my ignorance. So I want to make sure, because I think you just blew my mind, and I want to make sure. So you're telling me somebody has a, say, $5,000 deductible on their regular private health insurance, because somebody with ACA wouldn't need this, correct? Or would this be beneficial for someone with ACA as well?
Well, it depends, because if somebody in the ACA still has a higher deductible, or that's the plan that you choose, then yeah, you could still use this. But a lot of the times, if somebody's making less money, you go to the silver plans and you'll see CSR. CSR stands for cost sharing reduction, if I'm correct. And that means that your deductible is also lowered on top of the premium. So not only is your premium subsidized by the tax credit, but your deductible is also brought down as well. So chances are when you get somebody that's low income, they're still gonna have some type of deductible. It's true, copays as well can go down. Sometimes people can get free copays, but it depends. If they have a medium-sized deductible, yeah, put this on there. If they have no deductible, at least offer them life insurance, right? So that they have those living benefits, so that they can pay the premium, they can not work, whatever the case may be. But yes, this is more designed for people that have a deductible. Because no matter what, I'm always going to offer life insurance. But if they have a deductible, then I'm also going to add this as well.
And so this doesn't, so unlike the other insurance that they might get, which pays a certain amount directly to the medical facilities and providers, this pays money directly to you so that you can then turn around and pay that deductible or whatever you need to the medical providers. Is that correct?
Yes, because this is going to pay a lump sum benefit.
Right. Does this pay, is this a kind of per incident thing, or is this a one-time thing, or per year? You know what I'm saying? Like if they get a 5,000, they have a max 5,000 that pays out in a year, or?
So good question. So most plans that are like this it resets every year. So if you continue to pay it the next year, yeah, you should be able to be just fine, unless it's the same exact critical illness. If it's the same exact critical illness, usually it's half. So let's say you got a heart attack 1 year. The next year you get another heart attack, you're not going to receive the full amount, it'll be half. Is that something that the client needs to know right away? No, because if you throw up that on them everything, the chances are they're not going to buy, or they're going to be confused. Like the point of all this, I know I'm giving you guys a lot of information, but you also want to make it super simple. Like when I say what I tell my clients, those are the things that we should really be holding on to and making sure that's what we're regurgitating. Because if we're telling them everything that I'm teaching you guys today, forget about it. You're not going to close. You're not going to close anything. This is for you to know. So I'm glad that you're asking these questions, because that's going to make you feel more confident. But chances are nobody's going to ask you that question as a, not nobody, but most people will not be asking those type of questions unless they already know about insurance. But no, you're a little technical like myself, Tanisha. I see you.
That's what I was gonna say. I'm a technical person. I gotta the better I understand it, the better I can know if it's going to work for somebody. That's what I'm looking for. I'm not looking to tell them everything. I just want to make sure I know that it's gonna work for them, because I understand how it works.
Yeah. So for critical illnesses and accidental medical expense riders, like this, that's normally how they all work. Is it resets every year, but if you're diagnosed or treated for the same thing, then usually it's just half the coverage amount that originally been offered. Okay.
Thank you.
Yeah, of course. All right. Anything else, guys? Or by show of hands or messaging, do you guys want me to go over a little ACA?
Yes.
Yeah. Anybody else?
Yes, please.
Lucia. Okay. All right. I'll do it then. So let's quote somebody. Oh man, how did that pull up? It's not. Okay. You know what? Let me just kind of show you guys what it would be once you log into your own. So you have your Health Sherpa account. You're going to have this up here once you start getting appointed. You could quote off exchange. Off exchange just means that you know that they're making more than this right here. That means that you're not even going to look for any type of tax credit or subsidy from the government, because you already know they're making way too much money. But they're not healthy. That's why you would continue to go to ACA. And then from there, so we're going to stay on exchange. Okay. And it doesn't really matter how you do it, really. I would just keep on exchange. But just in case anybody was wondering, off exchange means that you're not asking for any type of tax credit or subsidy from the government at all whatsoever. So let's go on exchange. Same zip code. Not going to be 35 for long. And I'll mess around with this for a little bit. So let's say, what was it, like 50 something per person? So let's say I'm close to making almost 50. Everything's going to pop up here on the right-hand side, always. And then boom. Look, this was 305. But because of this tax credit, it comes down to 109. Deductible is still high, but it's only 109. Let's say that I want to just do silver. Let's do silver plans. Well, a lot of times I'll click expanded bronze and silver. Still high deductible. But look, doctor visits are free. It's $80. It's free. What's the difference? Same deductible. Like, it's crazy. So this looks like it's a limited plan, which means that not too many doctors are accepting of it. Excuse me. Yeah, this plan is a no-brainer. I would get this plan in a heartbeat. So see how this is? Like, if you guys compare these two, it's like, why would I ever choose to save $5 to get a plan that is totally different, right? So let's scroll down a little bit more. You also want to stay away from companies that not too many doctors are accepting. A lot of these newer companies that are out are not that great. If you're in Florida, Florida Blue is one of the best, hands down. Then next goes Ambetter, then it goes Oscar, and then United Healthcare has just recently joined the space, but we'll get there. But it's also on how the client feels, you know, because a lot of times they'll hear United Healthcare be like, oh hell no, I had a horrible experience with them, I'll never use them again. Okay, no problem. So you always want to have at least 2, maybe 3 companies that are going to be your go-to. And every state is different, of course. Like, there's obviously not a Florida Blue in Texas. There's not a Blue Cross and Blue Shield in Texas and California. So you got to pick and choose. Now, there are a few states that are what's called state exchanges. Is there anybody in California here? Nobody in Cali. Okay. So I think I have Texas, Florida, and Illinois in the house. Yeah. All right, cool. So then if you are in Texas, Illinois, or Florida, we're good. We are not a state exchange. We're what you call a federal exchange. So we run everything on a federal level. The state exchanges are going to be states like California, Nevada, New Jersey, definitely New York, Pennsylvania, Kentucky, Oregon, a few more. So there's a small list of states that decided to do it on their state exchange, which means we are not going to be writing those pieces of business, mainly because it requires a whole nother certification for each state. Gets to be a real pain in the butt. But I believe California is about to be set up. Pennsylvania, I believe is set up. But we really wanted to focus on more of the federal exchanges. But anyways, back to the health insurance here, looking at the different carriers. I'd say, look, Florida Blue is not much more than 115. So there's 2 different options when looking at Florida Blue. You have My Blue, and then you have Blue Select. My Blue is a very small network. Blue Select is much larger. Oh, Clarissa, you're in Cali. Okay, do you plan on selling any health? Do you plan on doing any business with that? You can unmute yourself if you want. Okay. Well, Clarissa, if you do decide to get into the health insurance market space, just reach out to me or Tony, and we will. Yeah. So you would go to coveredca.com. It's not .gov. I think it's coveredca.com, and that's basically, so each state has their own website. So like for Kentucky's like Connect, for PA's like penny.com, something like that.
Sorry, I couldn't figure out where my freaking mute was.
Oh, okay.
Sorry about that. But yeah, I'm interested in learning how to do the medical. I've been licensed life and health for 6 years now, but I've never written a health policy.
Okay. All right. Do you know many people in Cali that need help with that?
Oh, yeah, for sure.
Okay. All right. So then we'll get together. I'll talk to Tony a little bit more, get everything up and running in the state of California for you, because I know we have a few other people in Cali too.
Okay.
So rather than just being like, here, go to this website and figure it out, or working for free, so to speak, we would at least be able to submit the application for them and then see what other holes that we could fill, such as life insurance or, different riders.
Okay.
But
yeah, I'm interested in that. So
Okay.
I'll follow up with that.
All right, cool. So I will add you onto the health chat. Now, do you have any other non-resident states?
I'm licensed in Michigan, Ohio, Louisiana, Georgia, Las Vegas, Nevada. I think that's about it.
So North Carolina is a state that you can purchase that you will never have to purchase again.
Okay. My sister's in Greensboro, North Carolina.
There you go. You buy them one time and you'll never have to repay them again. Have you been up to date with these states? Because you can't just buy them once. You got to buy them.
Oh,
Every
yeah.
state is different.
I
Okay.
have to buy them every 2 years, and Las Vegas is every 3 years. But theirs
Yeah.
is the most expensive. Yeah.
Well, Illinois is the most expensive. They're trying to charge me a little over $700 just to renew with them.
Oh my
So,
God. Yeah, no, I'm not licensed in Illinois.
yeah, but that's why we got everybody else out there
Yeah,
to help us out with that, right?
Oh,
So
that's crazy.
yeah, the first year was not that expensive, but once I went to go renew my states again, I was like, oh, hell no, I'm good. I'm okay.
Right. Oh my God.
Unless like
No,
I
I
had a
think
huge pending application that was going to pay for that 700. I was like, nah, I'm good. I don't do that much business in Illinois.
right.
But yeah.
And you have to get life and health separate, or it's together when you get a non-resident?
So normally the way that the non-resident works, it's life and then accident. So
Yeah.
accident is your health technically.
Mhm.
Got it.
Yeah. So most of the time it's together. I think they're all together. I'm pretty sure they're all together, like life
Yeah,
and
because
accident.
when you get your license, you normally either take the exam for life only or life and health. So it's on your license as both. So when you get non-residents, you have to register as both together. Yeah.
Right, especially if you want to write business, in
Right.
both. Yeah. Okay. Cool. So let me get back to the health insurance part here over here on Sherpa. I'm gonna go ahead and change my income.
Rob, real
just-
quick, on
yeah.
my ACA carriers, I don't have Florida Blue.
So what you need to do is go to your gearbox, and then you got to turn your referral on.
Okay.
Here, let me do it for you real quick. See what I did?
Yes.
Okay. And then once you come here, it's going to give you the option to turn on your referrals.
Oh, okay,
And
got it.
then-
So the ones that you're appointed or you're going to use referral only.
Exactly.
Got it. Okay.
Exactly.
Perfect.
So you do all these, and you can do this automatic on all of them. Like let's just say you're not sure, click appointed, because if and when you submit an application and they go to check if you're appointed and you're not, it's automatically going to just send you a referral.
Okay, thank you.
Sure. If you're not sure on what carriers that we're appointed with, because look at all this. Look at all these carriers in Michigan. We're not appointed with all those. So it's a lot of paperwork. It's a lot, a lot of stuff. So we're better off just getting the larger companies that are most well known, and then refer anything else out. So that allows us as agents to still do right by the carrier, by the client, and still make, you know, something. So getting appointed will give you 15 to, I don't know, some as high as $30 a month on residual income per member. So if you have a family of 4, that's per member. Now for the referral normally is, it depends on the carrier. It depends on the time of the year, whether it's in open enrollment or out of open enrollment. But once you log in, you'll be able to see all that. Okay. So for in open enrollment, you should be able to get $100 per person. That's a referral. And for outside of open enrollment, it's like 25 or $50, depends on the company. So at least it's something. But that's why we're trying to cross sell as much as possible for these guaranteed issued policies that you don't have to be healthy for. Those are the riders from the National General I showed earlier. And then the people that are healthy that just happen to not make as much money, that's our main focus, to make sure that they have life insurance. Because chances are people that are within a low income think that they can't afford it. But if you give me a budget of $150 and your health insurance is only $80, you better believe you're gonna have some life insurance. That's how you do right by people. I mean, you obviously tell them, you don't just like slide underneath the rug and not say, oh yeah, everything is this, or your monthly is this. Like, no, you want to tell them that, listen, hey, what I do is I normally put them on hold. If I'm not talking and chatting, like while I'm doing everything, I'm putting them on hold. I'm saying, here, let me go ahead. I'm a full service broker. So that means that I don't charge anything in additional. Going through me is just like going directly to the carrier. So I don't care who we go with, as long as it's got everything that we're looking for and is obviously affordable. Is there any specific coverages, any specific companies? Is there anything in specific that's really important to you so that I make sure that I have it included? It's a really good question that I use. Is there anything that's really important to you to make sure that I have included? I ask, is dental and vision important to you? Because I don't want to offer somebody dental and vision if they don't want it. What's the point? So big question, is dental and vision important to you? Once I understand that dental and vision is important to them, very, very easy for me to say, listen, I came back and I got you one of our elite packages. Okay, our elite packages. Because who doesn't want an elite package, right? Like, who doesn't want the best of the best? And it's affordable. So if you're telling me I got an elite package with health, dental, vision, and life insurance for only $150 a month, yeah, give it to me. Give it to me. I've never had anybody say, no, I don't want it. No, I don't want the life insurance. Honestly, I've never had anybody tell me that. Never. And if you do come across it, but okay, well, do you currently have life insurance? I mean, some of these people you're already talking to, so you know a bit about them, and you're only servicing the health just because you want to make sure you're doing right by them and you keep them on the books. And just like Tony says, somebody else can come behind you, sell them health insurance. One of your life clients I'm talking about can come behind you, sell them health insurance, and then also try to sell them life insurance. And guess what policy they're going to cancel? Yours. So it's really important to have health insurance for retention as well. I think health insurance does way more pros than cons. Is it a pain in the butt? Is it a little bit confusing? Yes. Is it a little bit time consuming? Yes. But that's exactly why you have someone like myself for your first few cases. I would love to be able to just jump on a call with you guys. It doesn't have to be a Zoom. I do most of this over the phone anyways, as I work across the country. So it's pretty easy to just paint a picture and keep it super simple and straight to the point. So with that being said, let's kind of go back to the savings. Okay, so let's say that I'm making $60,000 a year now. You know, that's over the amount. Probably no savings. Now I'm paying full cost. I don't want to pay full cost. I don't ever use the insurance. What's the point? Remember, this is where it's starting. Let's see what platinum is. Oh, hell no. No, not I. Not I. The only reason why I would ever suggest something like this to somebody, and this is an individual, guys. This is an individual, one person. I remember I helped an elderly lady out that was like 63 that made a lot of money and did not care one bit. She paid almost $2,000 a month in insurance. $2,000 a month. I personally can't imagine somebody paying that much, but she did. And such, it wasn't on a percentage, it was per member. So, but remember, it doesn't matter what their premium is, you're always going to receive the same commission. That's with ACA. For health, that is a percentage. Health is a percentage. And if you need to know the percentage, then where is it? Here we go. So this is dependent on sales. If you haven't sold anything yet, you're going to start off here. Now, this is of the monthly premium. Now, you can decide, excuse me, now you can decide, again, whether you want to do 6-month advance or you want to do it as earned. So you're going to receive 12% of that monthly premium as earned every month, or you multiply it by 6 and you get that lump sum. But if they cancel, you obviously owe that money back, right? Chargebacks, name of the game. So let's go back. The only way I would do this is if somebody had pre-existing conditions and made a lot of money and they didn't care. That's the only way. So other than that, I think I covered most of the spectrums and most of the examples of the type of clients that you'd be receiving through the ACA and on the private market. Does anybody have any other questions?
I do have one. If you get someone that is coming from another broker and you're going to enroll it, is there any extra steps to do the enrollment, or is just the same as if you were getting a new client?
Good question. So if I'm going to start an application, I'm going to put their information here and search the marketplace, because this is connected to healthcare.gov, right? So a lot of times, if they've had an application that they started last year, or they had one from last year, however long ago, you could still find it. And you're going to click on their name, you're going to verify their social, you're going to verify all the information. Okay, this is you, perfect. You're going to click on that. All their information is going to pull up, and you're just going to verify everything. That's it. You're just going to verify everything that pulls up. Yes, use our healthcare.gov direct. So this is still connected. So that's how you would search. If there is nothing, then you just continue to new application.
Got it. Thank you.
Yep. Any other questions? All right. Well, listen, guys, it's been a true pleasure. We went a bit over time today, but that's because we covered the ACA. I hope I was able to provide everybody a lot of value. Remember that this is a great tool to be able to keep your business, to also talk to them every year, to also include taxes. Because guess what? If you're getting an ACA plan that has these tax credits, yeah, you're definitely going to have somebody that knows what they're doing when they file your taxes. So no problem, guys. Hey, I'm going to do one of these Tony things and say, if you have any pieces of information that really stuck out, please post it in the group chat, and I'd love to get your feedback.
Thank you so much, Rob.
No problem, guys. Have an awesome rest of your weekend, and
The recording,
see you on
how do
Monday
we
night.
access the recording?
All right,
Say that
thank
again?
you.
How do we access the recording? You gonna send it out? Or?
Let me stop it now.